Hey, Dr. Ruth Roberts here, the creator of the original Crockpet Diet and holistic veterinarian. Hoping you guys are having a fantastic day on this Thursday, sitting on the back porch enjoying a really early summer almost, and got the hummingbird feeder. See if I can figure this out with my finger right here. So hopefully you guys will actually see some hummingbirds come up and check it out. So I've got a lot of stuff for you guys today. First, I want to remind you something. Yes, I've got a ton of experience. Yes, I've got a ton of ideas, but I am not the person looking at your dog or cat. So remember, take everything I say with a grain of salt. Talk with your veterinarian. Make sure that what I'm saying is actually making sense for you, for your pet, and for your situation. So having said all of that, let's get into a couple of things. Got some stuff written down because like a lot of old dogs, the memory doesn't work quite as well as it used to. But first thing is dental tips. We had a couple of questions on that. I've used Plaque Off for a bunch of years, and I like it pretty well. I will say, though, that there's not a panacea with that. So the best thing to do as far as dental care for your pets is brushing their teeth. And I would be lying if I told you that I'd do that for all 7 of our guys. We've got some older dogs. Actually, everybody's older. So we try to give them things that are going to help scale their teeth just by chewing. So things like carrots, big chunks of carrots that, got a couple of inches in diameter there, so they actually have to gnaw on it. So raw bones are good for younger dogs. You want to go with the steak bones, things of that nature. Avoid steak bones, but go with the marrow bones that are big enough so they can chew and gnaw, but not actually swallow pieces of bones. That is a real concern. Cooked bones are more fragile than the raw bones. And, if your dog is older, 7, 8, 9, 10, and it's never chewed bones before, probably not a great option, simply because their teeth are already aging. They can crack teeth, and that can be very unpleasant and pretty painful. So that's not so awesome. Chicken gizzards are fantastic for small breed dogs and cats. There's a hummingbird, cool. So the reason is that they're incredibly, if you grew up in the South, you may have eaten chicken gizzards and you know how chewy they are. And that's why they work well for dogs and cats, because they'll gnaw on them, and that on the chicken gizzard actually shears the yucky stuff off of their teeth. So that's a great option. Any number of things like that. Plaque Off, as I mentioned earlier, is a kelp-based product that you add to the pet's food. It helps to change the bacterial composition in your pet's mouth so that it makes it harder for the bacteria that causes the plaque and calculus to stick to your pet's teeth to actually do that. So that's been helpful. There's a whole host of stuff you can add to the water. I've never seen any of those be terribly helpful. Some folks have used Liba 3 sprays and various other sprays like Oxy drops, things of that nature, and they've had, repeated some pluses, but mostly not working very effectively. So the key thing to remember is consistency, and the other thing is to make sure if you're using things like bones, gizzards, things of that nature, watch your pet for the first several times that you're giving them this. Only give it for, say, 3 to 5 minutes for 2 reasons. One is, A, make sure they're not trying to chunk down a big hunk of grossness and create problems for themselves as far as getting it stuck in their esophagus or somewhere down lower in the GI tract. And make sure they're actually chewing. If they're not chewing and they're just trying to swallow it whole, kind of pointless. The other thing is if they haven't been doing a lot of chewing, you can see these guys actually wake up the next day really sore because they've spent 30 minutes chewing on a bone. And like everything, if those muscles aren't being used very often, it just doesn't work that great. So limit the initial time, watch them carefully to make sure they're not going to swallow stuff whole, and kind of move on from there. So hope that's helpful. Sally Ferry asked some questions about joint supplements, and in specific, when to start them, when to use them, that kind of stuff. And there's an interesting thing that we forget about joint supplements. Glucosamine and chondroitin are actually anti-inflammatory agents. And so if we think about chronic disease in terms of its underlying mechanisms, inflammation is one of the big ones. So for that reason, and especially for dogs that are predisposed to joint disease, like German Shepherds, Labradors, most of the large breed dogs, I typically recommend starting them even as puppies with low doses or half doses of joint supplements, and then once they hit 4 or 5, using it at full dose. Sally, as I've mentioned in the past, has done a lot of rescue work for Above and Beyond English Setter Rescue, and that's where I've gotten both of our setter dogs, the Esau and Gracie. So these guys run. They will run from sunup to sundown if we let them. So for the breeds that are extremely active, or if you're running with your dog or walking it a lot, that kind of stuff, especially if there's a lot of concrete or asphalt, go ahead and start using joint supplements early. Remember, they are largely composed of chicken, so if your pet is sensitive to chicken, perhaps not a great option. Plain MSM could be a good option there. And just kind of watch and see what they do or don't do for your pet. My favorite is Arthur Eats Gold. It's sort of the kitchen sink of joint supplements. It is flavored with chicken, so again, that's a small problem if your pet is sensitive to chicken. That's one of the next things in the hopper of supplements to design, is a joint supplement that pets with food sensitivities can take and enjoy and not have issues with. So that's what I've got about that. Angela Hardy wrote in, and she's got Scotties, and these guys frequently do come up with liver enzyme elevation. So she's been suggested to use Denamarin, which is a combination milk thistle and SAMe product, and she wants to know what else, what other options there are out there. I'm not a huge fan of Denamarin for a couple of reasons. One is it's extremely expensive. The second is you have to give it on an empty stomach for it to be effective, and that can cause vomiting for many of these guys. So as far as Shelties go, that's another breed that has liver enzyme issues, and Scotties, there's a couple of things to think about. This often can be associated with low thyroid function, so it's important to check with your veterinarian, make sure that that is not an issue. And milk thistle, I think, is the best option as far as general liver sort of purging or cleansing, if you will. I'll often recommend using it on a weekly basis each month, especially around the time of Heartworm Prevention Administration. It kind of helps, A, helps you remember to do it, and B, it helps kind of clear metabolites of the drug out of your pet's system. So that's not a bad thing to do. Glutathione is another one. And then frankly, providing your pet with food that actually helps its physiology work better. I mean, that's the whole thing about the Crockpet Diet, is using food as your first medicine. So Angela, I hope that's helpful. There is a genetic issue with Scotties and Shelties, and so that's where making sure you're doing everything to protect their livers is extremely important. Let's see, Ray wrote in to ask us, we've had this series about cannabis and THC and CBD and how that can be used to help treat pets that have chronic pain or cancer. Dr. Silver, Dr. Richter have an excellent course on using marijuana in particular safely with pets. But Ray's question was about, doesn't THC shut down cytochrome P450 in the liver? And Ray, you're on the right track, but not quite there. So cytochrome P450 is one of the most important mechanisms in the liver to help clear junk from the system. And the way it works is differently in terms of dogs and cats, and that's why we have to use medications differently. So that's and great to see you guys are popping up some questions, and I'll definitely get to those in a couple of minutes. So that's the deal, is that it's not that it shuts down cytochrome P450, it's that cats in particular can't handle things as well as humans can or dogs can. And then obviously, if you've got a 30-pound dog that's eaten, a dose of THC that's for a human being weighing 150 pounds, that's not going to work out so great. Thankfully, most of the side effects are drowsiness and sedation for an extended period of time, but they can be very severe. So again, not so much that it shuts down cytochrome P450, it's just that dogs and cats don't have the same capacity to get rid of garbage that we do. And I think somebody had a question. Jennifer said that her bloodhound had elevated liver enzymes, and the Crockpet Diet really helped her with that. And it was primarily a gut issue for Jennifer's dog, and that's exactly what I'm talking about. Change the food, fix your pet's metabolism, fix your own metabolism. So awesome, Jennifer, glad that was helpful for you. Ray also asked, and Puka Love, this is going to kind of answer your question as well. Ray asked about his pets in kidney failure, and so his veterinarian said, oh yeah, you need to feed KD. And he's looking at the label of this thing, and it's got sugar listed within the first 5 or 6 ingredients. So called Hills to find out exactly how much sugar is in there, and they either couldn't or wouldn't tell him how much, which is always reassuring. And given that that he's uncomfortable giving his animal an unknown amount of sugar on top of a high carbohydrate diet, which is what the KD is, he's not sure if he's on the right track. And so here's my answer to that, Ray. One is, we typically tell you your pet's in kidney failure when the creatinine has pushed your pet into stage 2 IRIS disease. And IRIS is the International Renal Interest Society. And what that means is that the creatinine is typically somewhere under 3 for cats, and for dogs I think it's 2.6. And the numbers may have shifted recently. So here's what I'd say. If that's where your pet is, I would not change to a low-protein diet, because it's going to help encourage them to lose muscle mass, which is the last thing you want to have happen in an older dog or cat. Muscle mass is what helps them maintain strength and stability as they age, and the ability to exercise. So if they're beginning to develop arthritis, they're going to have much more issues if they've lost a ton of muscle. In humans that are on dialysis, most of the nurses in dialysis clinics spend a ton of time encouraging their patients to eat more protein. So where protein restriction comes into play in my mind, and don't misunderstand me. Yes, if you feed a lower protein diet, you will see the numbers drop. But you're going to drop back into normal range, and does that really mean that the function is better? And that's a huge question. So where I typically reserve protein restriction is for stage 3 or stage 4, which is stage 4 sort of end-stage kidney disease, if you will. And that's where we've done everything else we can think of, and we're just not making a dent. The pet's not feeling good. The phosphorus is so high they feel really cruddy. So, Ray, that's where I think protein restriction is important. And I go through this in great detail in our kidney health program. So I think that's it took me a long time to write this thing. It goes through both conventional treatment, alternative treatment options. We've got some modified recipes of the Crockpet Diet for kidney failure when the pets are in that advanced stage. So, Ray, you're right on. The other issue about the high carbohydrate, high sugar is, again, underlying mechanism of kidney failure is inflammation. This is being documented in mainstream medicine and literature now. Sugar and high carbohydrate diets are actually increasing inflammation off the charts, and they are actually what is responsible for the massive increase in obesity, heart disease, diabetes, whatever else you want to think of, cancer, kidney failure in humans, and probably in pets too. So we got told, oh, you have to eat low fat because that's what's causing all this stuff. Well, turns out the sugar industry paid for a bunch of papers, and that became the mainstream thought until, gosh, that was in the early 70s, and now it's 2017, so 35 40 years later, finally. Well, no, it was a study that the sugar industry had done, even though they actually knew that sugar and high carbs caused these things and not the fat. So that's that. I'll put a link to the kidney product there. We're, I mentioned a few weeks ago, we're in the process of updating our membership area, and I should have that completed pretty quickly. When that happens, people that have purchased the kidney health product or our gut health product will automatically get a membership of the original Crockpet Diet ebook and all the goodies that come with that, just because neither of those products were quite complete if you didn't have an understanding of basic Crockpet principles. So look for that. If you purchase those products now, you'll get upgraded at absolutely no charge. And we're also going into a big revision of all of these programs for you to update them, make them a little easier to understand, and get you more useful information. So we'll get that link there for you. Let's see. And then JJ SLG wrote us and asked about bladder cancer treatment. And this is where there's bladder cancer and then there's bladder cancer. So for instance, last week I told you guys about a lady that had been feeding the Crockpet Diet to her pets. Her dog developed bladder cancer, but the tumor itself was in a remote spot away from where all the coming into the bladder and going out of the bladder happens, and so surgically it was easy to remove. So what happens in bladder cancer, and that was awesome and extremely lucky, but what happens more often is that these tumors are at a region of the bladder called the Trigon. So if you think about the bladder being a balloon, so this end of the bladder is facing the head, this end of the bladder faces to outside. So we've got the urethra coming out here so that the pet can urinate and pass urine outside. And then in this area is the Trigon region. And what happens is, if the kidneys are up here, they produce urine, send it through the ureter, and the ureter empties into that Trigon region. So if your pet or you develop a mass in that area, it ends up acting like a valve, both for letting urine into the bladder and letting urine out of the bladder. And so in these older guys, we'll see symptoms like urinary tract disease. They're urinating frequently, maybe not a lot is coming out at one time, that kind of stuff. It's sometimes they'll see blood in the urine because the pet's straining so much as well. It's relatively easy to diagnose if your veterinarian has an ultrasound machine. It's easy to see the tumors there, get an idea of the location, and also how much of the bladder is involved. Conventionally, there are some surgical options, and when the tumor is away from that Trigon region, that's a good option simply because it's out and over and done with. There's 3 types of tumors that show up typically in bladder cancer, and that's the first one is transitional cell carcinoma. That's the most common. Squamous cell carcinoma can show up especially in cats, and that's fairly rare. And then lymphoma is another one that shows up as well. So the conventional treatment is a little bit better as far as chemotherapy and things of that nature. The cornerstone of conventional therapy, interestingly enough, is a non-steroidal anti-inflammatory. What was researched in people is piroxicam, and that has been used for a lot of years in dogs and cats. And then meloxicam, or Metacam is the trade name, is the other one that's used for dogs and cats. And frankly, when I've treated bladder cancer, that's what I've gone for. The other key, anytime cancer comes up, regardless of where it is again, the underlying mechanism is inflammation, along with the liver's inability to get rid of garbage, and so more cell replication errors occur. When that happens, more cancer cells are likely to be produced. And so that's where reducing inflammation, feeding a wet diet is critical to help keep the cells hydrated so that you can deliver good nutrients to the healthy cells. And then that's where I encourage people to modify the Crockpet diet to a very low carbohydrate diet. And the reason is that low carbs make you or your pet a fat burner. Cancer cells love sugar. So if we're feeding them less sugar, we're reducing their resources. So our goal is to feed the dog or the cat and not the tumor, if that makes sense to you. So those are kind of the two cornerstones. And then it depends on what type of tumor is there and what symptoms your pet is experiencing. In Chinese medicine, most solid tumors are considered to be blood stagnation tumors. So blood is considered to be one of the vital fluids. Just remember, most of these concepts in traditional Chinese medicine were developed, 3,000 to 5,000 years ago. And this is long before microscopes or anything of that nature. So what the doctors then thought about blood was that it took nutrients to the cell. And if you're blood deficient, the sort of early signs are things like you go gray early, your nails are dry, your hair is dry, your skin is dry. We see this with our pets. And interestingly enough, sometimes this can be associated with low thyroid function, as if they start developing vitiligo or decolorization. So that's kind of the basic concepts. In the Crockpet diet, a lot of it is built on using blood tonics. So beef is a great blood tonic. Kidney beans are a great blood tonic. Sort of red things are good blood tonics. And also using foods that tend to dry things up and shrink masses. So again, beans help with that, and mushrooms, things of that nature. And that's part of what we talk about in the Crockpet Diet ebook. So that's your second tier support for pets with bladder cancer. And then the third is traditional Chinese formulas that are blood tonics and also might shrink tumors. So they often involve things like curcumin, which is the active ingredient in turmeric, and you're reading a ton about that right now. So those are important. Again, those are specific to what is showing up for each pet. So if you've got an acupuncturist you're working with, they can help direct your herbal formula treatment. If you are just starting to explore alternative medicine, there are two great practitioner lookups. The AHVMA, the American Holistic Veterinary Medical Association.org, and then TCVM, so Traditional Chinese Veterinary Medicine.com. They both have practitioner lookups, and that's very helpful. So that's for more specific treatments for your specific pet. That's where I would suggest going. The interesting thing is that with bladder cancer, just using Metacam and sometimes the chemotherapeutic agents, the survival times, median survival times, were somewhere around 6 to 8 months. And many of my patients, we were able to get out to 18 months, and in one or two cases out to 2 years before symptoms became really difficult again. So I hope that is helpful about bladder cancer. And that's what I know for this week. Puka Love, I think I got your question answered, and yes, Crockpet Diet is definitely suitable for dogs with kidney failure. And in specific, even before you need to go to a low protein diet, just feeding more moisture in the diet often is enough to give the kidneys a break, because they have enough moisture to deal with and help them do their job better, getting rid of the waste products. So have you guys got any questions I haven't answered for you this week? And if not, please come join me again next week. Do this on a weekly basis. You can message me on Facebook, email me at support@theoriginalcrockpetdiet.com. Jenna's manning that mailbox, and she'll get information over to us. And yes, and Kelly, you did send a message yesterday. Thanks. I forgot to add that into my list of stuff. So about using something other than poultry in the Crockpet diet, and that's where rotation really comes in critically. So the three proteins I'll typically recommend there are turkey, beef, and pork, because they're pretty easy. So again, in the book we go through a list of optional proteins that you can try, but really pretty much any protein source that you have readily available is a good one. In South Carolina, it's really hot, so we try to avoid encouraging feeding a lot of lamb and venison, as those are hot proteins, but it just depends on what your pet can or cannot handle. And so what we'll often do is, in practice, I would use Dr. Dodd's NutriScan reports, or if you know certain foods are a problem, we just leave those out and then make other selections and rotate through them. So Kelly, if you got a recipe that you downloaded some time ago, it says to use, I think, turkey, beef, and pork. And really the updated information that we've got in the ebook talks much more about using a single protein and rotating those foods so that your pet is less likely to develop an allergy, and it's also crystal clear when there is a sensitivity to a particular protein. So I hope that makes sense. Any questions you guys have left? I think I got all of your question. It's unfortunately it blocks off a little bit of the question or the post sometimes here. So I hope I got everything for you guys. Have a fantastic day, and until next week, remember, your pet's best health starts in the bowl. Take good care. Thanks.